Continue to remember the people that we lost due to COVID-19 complications.
And that includes where we are now as well as where we once were. Very happy to have on the show right now Dr. Paul Nee, an infectious disease specialist at Nuvance Health in Danbury. And Dr. Nee was treating the first patient in Connecticut to have COVID-19. So very appropriate to have you with us here to look back on the last year. Doctor, thank you so much for joining us today. How are you?
Thank you. Thank you for having me.
Yeah, glad to have you. Why don't you take us back just to that first time and what it was like treating COVID-19 with a little bit of a heads up, but still so many unknowns.
Right. I think you hit on it right there. There were a lot of unknowns at that time. We, the U.S. health system, and I know Nuvance and across the state, we were well aware of what was going on in China back in January, and we're making preparations well into February. And when the pandemic hit Italy, I think it really increased our tempo of what we were doing. And, we were performing many exercises in terms of getting prepared, but you're never really prepared for your first case 100%. And, as you remember, one of the first sort of case was actually an employee we had here, not what we were planning for initially. And then we did have our first patient in the hospital. So, there was a lot of preparation for that, a lot of buildup. There was a lot of fear that we needed to overcome. And the fear was there because we just didn't have the knowledge to know what was going on. But as we moved into, into March, we got to know a little bit more.
Well, doctor, it has been a year since this all really began and ramped up. We've learned so much in that year's time. What are some of the decisions early on that you wish maybe happened differently on both the medical front and also from the government?
Yeah, again, when I think one of the things at the beginning is in retrospect, we had our first case. But at that time, probably COVID was rampant at that point. We probably didn't know we had as many cases as we did. And then we began to see, 2-3 weeks later, really those numbers start to, our admissions start to increase in the hospital. So we closed down. We thought it was right. But in retrospect, maybe if we had closed a little earlier, things might have been better. But again, that's with a retrospectoscope, right? We're looking back and seeing that. The things we did early on, again, because of the lack of knowledge, we didn't know, but we adapted quickly. And it wasn't just, our hospital, it was all the hospitals. Some of the things we did, we collaborated with other hospitals, not only locally, New York or within Connecticut itself, but across the nation to get everybody's experience to what we're doing, what we needed to do, because our early treatments really didn't work. I mean, you remember things like hydroxychloroquine or some of the HIV drugs we thought would be beneficial. They really weren't. And we really need to switch gears quickly at the end of March and beginning of April because nothing we were doing was working.
And some of the things that have changed over the past year in terms of treating COVID-19 didn't seem like huge groundbreaking changes, just maybe rolling people over to a prone position or using high flow oxygen. But what I want to know is how are you able to try to make those decisions to change treatment given that you don't have the time to go through all the scientific rigor you would normally need to go through to determine is this going to work or not?
Right. Yeah, no. So those were the things we sort of experimented with early on. We knew things like proning were beneficial in the ICU, and we really sort of rolled that out into the floors. And again, that's where the talking to other people with their experience about what they were doing right and not right, and what we did we're doing right and not right, and that collaboration helped. But, moving to things like high flow at the time, we didn't know how, we were very concerned about, spreading virus through the air using this. And how did we mitigate that without the equipment we might have? We knew we had plenty of PPE, but we didn't have maybe some of these negative pressure rooms. How safe was that? And we learned as we went along about how to mitigate those risks and how to stop doing things like intubating people, putting that breathing tube in. We learned that very early on that it probably wasn't beneficial to be doing it the way we were doing it. And we made that switch to those things like high flow or non-invasive ventilation. That sort of was one of the turning points, I think, for many, many places in the United States, not only here at Nuvance.
Doctor, we have come a long way. Connecticut has come a long way when it comes to the number of cases, positivity, hospitalizations, and deaths. The number of new COVID-19 cases in Danbury and that area of the state has declined. What else are you seeing in the community, and can you explain that decline in cases?
Yeah, it's a great question. I think clearly we've seen a benefit of the vaccinations, particularly in the older population, those who are more vulnerable. Those in the facilities, we are not seeing admissions from facilities like we were during the winter, and that is clearly, in my mind, enough reflection on the utilization of vaccines. So I think we're clearly seeing that. We haven't, I think, masking, social distancing, those things, which we are now out of the holiday season, that's been a benefit also. So we've certainly seen that. And I think those two things have really helped drop those numbers.
Doctor, last question. If I went back in time and talked to you 1 year ago and told you that on early March of 2021, the United States would be just shy of 100 million vaccines administered, vaccines, 3 of them authorized, all of which appear to have an efficacy far beyond what the U.S. government was willing to accept as okay. What would you have said if I told you that's where we would be in the span of 1 year?
I would have not believed it. I really would have said that's highly unlikely, but we know we got there. The science is there. I remember reading that first Pfizer data when it came out, and the smile on my face looking at that efficacy data and what they had, it was stunning. I think we were all shocked and so pleased that we were able to have a vaccine that was this efficacious, and the other ones that rolled out afterwards, seeing that. It's an incredible feat of science. It's one of those things that I think is going to change the way we do things. This is really almost a miracle in a way. The ability to get this vaccine out in such a quick time period, and that it's so safe.
Well, Dr. D, thank you so much for taking the time to join us.
Thank you.
It's our first chance to talk to you. Let's do it again soon as